I'd gone from a very, functioning woman to literally, I couldn't go to work.
I had no idea that sudden loss of estrogen in my mid-40s could have such an enormous impact on my life. It felt as though I was drowning.
Menopause hasn't been taken seriously by the medical establishment.
Menopause has been sidelined, really. I don't think all the doctors are aware of the health risks and the importance of hormones for women in their future health.
The menopause. Something that roughly 50% of the global population will experience, and yet research from the independent Nuffield Health Group found that more than 2/3 of women say that there is a general lack of support or advice for those going through the menopause.
In the UK alone, there are around 13 million women living either perimenopausally, known as the 10 years leading up to the menopause, or postmenopausally, when menstruation has stopped. Now, there are around 34 associated symptoms of the menopause, and of those 13 million women, 3 in 4 will experience symptoms, and 1 in 4 will experience severe symptoms. Symptoms so severe that 1 in 10 will consider leaving their job over them. Now, despite this, only around 1 in 3 will actually go to their GP about it. And then if they even make it to the GP, menopause awareness advocates say that there's a knowledge gap in the understanding and the treatment of the menopause, which they say can often lead to a misdiagnosis and inappropriate advice.
To try and understand this better, I've come to one of the few menopause specialist clinics in the UK, the Newson Health Menopause and Wellbeing Centre in Stratford-upon-Avon, to speak to Dr. Rebecca Lewis, a leading practitioner in menopause health.
So it's a year and a day after your last natural period. And what happens in the menopause is that we run out of eggs, which is entirely natural and a normal process. And as a result, our hormones reduce. So the most important hormones that the ovary produces are estrogen, progesterone and testosterone. The time up to the menopause, called the perimenopause, is a time when our hormones are fluctuating enormously, and this can give rise to a lot of symptoms for women.
So what are the symptoms beyond hot flushes?
It is so much more than that. We now know that most cells in the body have an estrogen receptor on them. So estrogen gets everywhere in the body and is very important. It underpins so many functions of the body, particularly in the brain. The limbic system is a very important part of the brain for our mood. Word finding difficulties, palpitations are also very common, vaginal dryness, pain, burning. We lose the layer of lubrication in the vaginal walls become thinner, and bladder problems as well.
So why is there a knowledge gap in the understanding of the menopause?
We practice in areas of expertise, so if someone goes to see somebody about their muscle and joint pains, they might not necessarily understand that it's due to their hormone problems rather than an arthritis, and that's a problem with specialist sort of based medicine. And I think there's just been a lack of education for doctors.
Women have been traditionally left out of medical research. Not only was this because it was a field dominated by men, but also because of fears concerning the impact experimental research could have on fertility, as well as a belief that women's menstrual and hormonal fluctuations could complicate results. Advocates say that this lack of understanding in women's health continues to have a knock-on effect today, with menopausal symptoms often dismissed as something else.
For me, I didn't even know I was in it or going into it. I had 4 kids, I was a busy mum, doing school runs and going to work and I was always a coper. I'd keep going back to my doctor. I described it to him as I feel like I'm walking in treacle and through this sort of thick fog. And they said, we think you're probably suffering from depression. Then I went back to the doctor again and they sent me to a cardiologist for the heart palpitations. There was nothing wrong with me. They then sent me to a neurologist to see if there was early onset dementia, and there was nothing wrong with me. And then to a psychiatrist because I was wondering whether I was a hypochondriac or possibly I was literally going mad.
BBC broadcaster Kirsty Lang also shares that feeling of self-doubt.
It can chip away at your self-confidence as a woman. You're starting to kind of think, am I a bit useless? It all feeds into that, and it's, it can be quite depressing, And I'd always been quite a sort of fairly upbeat, happy, relaxed, self-confident person, and I could feel my self-confidence ebbing away.
The impact on mental health can be one of the most debilitating symptoms, with work and relationships hit hard. Katie had to leave 3 jobs.
I felt I was embarrassing myself. I felt like I was a fraud, that who was I kidding? So I retreated back because I thought it was better to just privately deal with this than pretend that, I can do a job that I thought I wasn't cut out to do. I felt like I was stupid. I was looking stupid. This was a woman who was fooling herself that she could work and have kids and run a home. So I left 3 really lovely jobs because I didn't, for undiagnosed reasons.
We currently have more women over 50 in the workplace than we've ever had. We've had an exponential rise since 1994, a 72% rise since 1994. So we have, we have an awful lot more women over 50 years old in the workplace. And so consequently, we have a lot more women in the workplace who are going through their menopause in the workplace.
That was Diane Danzebrink, who I'm on my way to meet. She's a menopause counsellor and founder of the Make Menopause Matter campaign, who has first-hand experience both personally and professionally of how bad your mental health can get as a result of the menopause.
I went into surgical menopause. Unfortunately, I had very little information prior to surgery and even less afterwards about the potential effects of menopause. Essentially, within a few months of my surgery, became a husk of the person that I used to be. I was almost non-functioning in every way. I came within probably that much of putting my car in front of a lorry. I can't tell you how I drove home because I don't remember that journey. But I immediately told my husband what I'd almost done. And that essentially was the crucial point in leading to me getting the help that I needed.
Diane isn't alone in this. Suicide rates for women peak between the ages of 45 and 55, and the average age of menopause is 51. A recent survey by the British Medical Association found that menopause symptoms affects the working life of 90% of menopausal GPs, with just under half saying that they don't feel comfortable talking to their line manager about this. So if the GPs are struggling, what does that mean for everybody else? Well, with more women over the age of 50 in the workforce than ever before, and with 80% experiencing symptoms in one way or another, menopause awareness advocates say it's vital that these women get access to the support and treatment that they need.
So treatment for these symptoms would be HRT, hormone replacement therapy, that's what it stands for, is literally just replacing the hormones that the woman has lost back to the normal female level, not at a high level, but just restoring the physiological level.
Now, HRT isn't appropriate for everyone. Some people aren't able to take it for medical reasons, and others prefer alternative methods like cognitive behavioural therapy or lifestyle changes. But for the majority of women, research shows that HRT works well.
We know that actually if you start HRT within 10 years of your last period, you can halve your risk of heart disease and help prevent osteoporosis. It also helps reduce in younger women, it's been shown that it reduces their risk of dementia, type 2 diabetes and obesity. So it's very, very helpful for women's future health, thinking about their hearts and bones.
Despite this, only 1 in 10 menopausal women take it, with many hesitant due to findings from a Women's Health Initiative study in the early 2000s that incorrectly reported an association with breast cancer.
In the study they did with the combination, women who got a pill that contained both estrogen and progesterone were compared to women who just got a placebo sugar pill. there was a decreased risk of breast cancer among women who were given the placebo. Why did the placebo have a decreased risk? Well, if you look at the women who took the placebo, some of them had been taking estrogen before they entered the study and were randomized to the placebo. If you remove from that placebo group the women who had been taking estrogen, the reported increased risk disappears.
It's worth noting, though, that the link with breast cancer is still inconsistent. As recently as 2019, an analysis that looked at all the data to date by Oxford University showed a slight increased risk of breast cancer. Despite this, the British Menopause Society, the Royal College of Obstetricians and Gynecologists, and the National Institute for Clinical Excellence have strongly defended HRT, maintaining the benefits outweigh the very small risks, and have accused the media of scaremongering.
So if NICE say that the benefits of HRT outweigh the risks, why do you think that some healthcare professionals still seem to be so unsure?
It's physician ignorance. What we usually tell women is suck it up, deal with it, get past it, and you'll be fine.
And it's not just Dr. Blooming that thinks that.
What do you think needs to change going forward?
It really comes down to a lack of education.
Research and training. We need the NHS and the education system to focus much more on menopause.
I think that every doctor needs to be trained in perimenopause and menopause treatment and care and really understand it.
And I think there's just been a lack of education for doctors. They haven't been taught. I wasn't really taught very much about the menopause in medical school, a little bit.
Whilst the MRHA, the authority on which medical products are safe, say that HRT should be taken at the lowest dose and for the shortest possible time, other leading authorities such as the National Institute for Clinical Excellence continue to suggest any risks are small. Campaigners say the inconsistent advice makes progress slow.
So you have the Royal College of GPs, you have the medical colleges, you have the Department of Health, and obviously you have the NHS involved as well. So it's more complex than I ever imagined it would be. Problem is that when you approach Royal Colleges, Royal College will just get back to you and say it's on the curriculum. Okay, well, what does that mean?
We reached out to the Royal College of GPs and the General Medical Council, the people responsible for guiding the medical school curriculums, to try to find out how menopause education is taught. However, both bodies told us that they didn't have the capacity to assist us. We did reach out to a number of medical schools, however, and medical students, and they told us that their menopause education generally consists of an introductory lecture, and then after that, students are encouraged to pursue their own menopause education through independent study.
Without this education, especially for GPs, many women end up having to pay for a private one, often paying up to £300 for an appointment. Advocates say it's not just education that needs to change, but also workplace policy.
Up to 10% of women actually leave the workplace. 25% consider leaving the workplace. You know, for me, policy's not worth the paper it's written on unless there is the culture there to support that policy. So we need a culture shift, and that is very much a long-term thing.
The government is taking steps to address the gap in knowledge in women's health. In March, they announced a 3-month call for evidence on the topic with a particular focus on the health of older women. However, it's not yet known what changes, if any, will be made as a result. We did reach out to the Department of Health to comment on this, but no one was available.
There absolutely needs to be commitment from stakeholders that there will be fundamental change. What we need are deeds, not words.
For some, a change in education, workplace policy, and more generally, a recognition of the impact menopausal symptoms can have on quality of life can't come soon enough.
With women's health, it has been neglected. The menopause is a prime example of that. The research is scanty compared with other areas of medicine. We need more research on that, and it needs to be in the foreground.
There's a lot of women's health inequalities going on, and it's crazy. And as you said, we're 51% of the population. This is going to happen to everyone. So let's get it right now, because it's costing a fortune, and it's costing women lives, women's marriages and their health.